Well, he came highly recommended by one of my really good friends who's a pretty much world-renowned attorney, personal injury attorney, and he had had surgery on both of his feet when he was younger, and apparently the surgery was so successful that even though he's in his mid to late 40s, he's very active and very speedy now, very quick on his feet. So yeah, highly recommended by Steve. And and then I did a little follow-up myself just to make sure, and everything that I could find about Dr. Nagler was nothing but the best. So that pretty much sealed it right there. At first it wasn't so much pain. I'd gotten the gout before, and I thought that might have had something to do with it, because I started noticing a kind of a deformity on my heel, and it kept getting bigger and bigger to where it was the size of a pretty large plum, and it stuck out so far that I couldn't get a shoe on. And if I was able to get a shoe on, then anytime I did any kind of walking or any physical activity, working out or anything, it would rub blister on there so bad it was extremely painful. And so I always just wore flip-flops, and then as time went on and on, it started hurting me more and more, and I said, man, I need to get this thing taken care of. So I came in for x-rays from Dr. Nagler, and he showed me that it was just solid bone, and to get rid of that problem, I would have to have my Achilles tendon severed, and then they would have to shave the bone all the way down and then reattach the Achilles. It sounds pretty gruesome, but he assured me that once it's done, I'll be better than ever. So I'm on my way now. Yeah, the staff is great, so nice. They're the ones that instructed me on where to get my little knee caddy, where the best deal to get my knee caddy was, and no problems with that. I mean, that's definitely the best way to go, because you can't put any weight on your foot, so you had to have it off the ground. And if I'd gotten a wheelchair, I'd be more inclined to just put my foot down on the ground. But with this knee caddy, you put your knee on the padded area and your foot just hangs out the back, and you just roll along on wheels, so to your destination, and then you can sit down in a chair or whatever you want. So yeah, it's good. Well, absolutely, he's a super good guy, and even better than that, a really good surgeon. And of course, I had pain, after it was over with. That kind of injury, you're going to have pain, but he provided me with the pain pills, and that got me through it. And now it's just kind of like watching paint dry. I just have to wait for my foot to naturally heal, and in a few more months, I hopefully be back better than ever, and running around and doing stuff again. So yeah, highly recommend him.